We do see a lot of patients who come to us with degenerative disease in their spine. For the majority of patients, that's what we are targeted towards, is degenerative changes. In a small minority of patients, they might come with spine tumors, for instance, or some instability in their spine for various reasons, degenerative being one of them. Spine surgery addresses narrowing of the canal, where the nerve roots go if you're lower down in the spine, or the spinal cord runs if you're a little bit higher in the spine. And usually how we address them is either through decompressions, where you're taking off some bones, some ligament, creating more room for the nerve roots of the spinal cord to run, or with fusions, or a combination of those, depending on what symptoms patients are having. Unless they are presenting with acute neurological changes, such as weakness or issues with their bowel or bladder function, we usually send most patients to physical therapy, to pain management, to see if through the exercises that physical therapy gives them or through the injections that they might get better. And 70 to 80% of people will get better without needing surgery. It's usually in the small number of patients who've tried all of those things, who on imaging has a pathology that we can address with surgery, that we proceed with surgery. So thankfully, there are a lot of non-invasive options before coming to spine surgery. We mostly do our cases in an open fashion, but we do have minimally invasive options as well. But the goal at the end of the day is to be able to address whatever pathology is going on. So usually, based on their images, we develop a plan. We have the capability to do image-guided screw placements, which I think increases the accuracy of the placement of the screws. Additionally, we have microscope available as well for our decompressions if necessary. But ultimately, our goal is, however we're able to address your pathology, and whatever is best in our hands, that's what we do. And we have the opportunity here at UPMC Williamsport to have different tools available for that. So usually what I do is to go through the images of the patient. Once we do that, then we talk about what surgery would look like. At every step of the way, we always ensure that we leave room for questions for patients, so that what seems very routine for us may not be so routine for them, and allows them to get that deeper understanding about what surgery means. We'll work together and we'll figure out a plan that works well for you.